Okay, we can. Hi, I'd like to welcome everyone to Council Member Tom Hucker's Town Hall. We'll start in just a few minutes. We're giving participants to join. Thank you. Okay, Susan, I think we're ready when you are.
Okay. Good evening, everyone, and welcome to Montgomery County Council Vice President Tom Hucker's virtual town hall meeting with U.S. Senator Chris Van Hollen. We're very excited to have everybody with us here tonight for this really important discussion about the county and federal response to the COVID-19 pandemic. So we will be taking questions from our participants tonight through the chat function. So if you do have a question, please type it in the chat area, your name and where you're from, and we are going to try to get to as many questions as we can during this hour-and-a-half period. If we don't get to your question, please reach out to the Council Vice President's office by email or phone, and we will get back to you. Also tonight, a very important announcement that there is a survey for you about the COVID response that is available to you if you're using Zoom through those controls there. So now I'm going to turn it over to the Council Vice President for some opening remarks.
Thank you so much, Susan, for joining us, and especially to our special guest, who I'll introduce in just a minute. I want to first thank everyone for joining us this evening. I'm really excited for tonight's event, and I look forward to sharing with you what the county and the federal government have been doing to address the COVID-19 pandemic. It's really hard to believe that 2 months have passed since Governor Hogan announced our first 3 cases of COVID-19 in Maryland on March 5th. During that time frame, our lives have been completely transformed in every way, and worst of all, of course, over 6,900 Marylanders have contracted COVID-19, and we have over 324 confirmed deaths in Montgomery County as well. For those of us who haven't joined us before, this is my 9th town hall event regarding COVID-19. And most recently, Congressman John Sarbanes joined us last week to discuss his efforts in addressing the pandemic. We've also had discussions with County Executive Elrich and Tacoma Park Mayor Kate Stewart and many other luminaries who are working hard to address this crisis. Tonight, we're going to have an update from our county's top health officer, Dr. Travis Scales, who's been working nonstop on this. And we're really excited to have as a special guest our outstanding U.S. Senator Chris Van Hollen joining us as well. But before we get to them, I just want to provide a quick update on the county's work at the local level. Our county government, you should know, has been working around the clock on this issue since we first heard about it. We've been meeting online almost every day to help address issues in real time. We passed a relief package that's here on slide 3 that is over $40 million in relief at this point. Let me hit a few of the highlights. At the top there, we have spent $10 million to help our hospitals ramp up. You might remember 2 months ago, we were very concerned that our hospitals might be overwhelmed with COVID cases. Statewide, we've stood up over 800 additional beds for patients and reopened the previously closed Washington Adventist Hospital in Tacoma Park. And now the hospitals are not as full as we feared they might be at this point, and we feel like we're getting on top of that. Part of that was giving $10 million to help our hospitals stand up the extra staff and the extra beds to make that possible. We've also spent $250,000 on hotel rooms for our beleaguered medical staff so they could get some rest in our hotels locally without returning all the way home to their families in between their shifts. And we've appropriated $350,000 to secure additional personal protective equipment for our residents and especially our first responders and medical providers that are on the front lines. And we've been working with our procurement director and local biotech companies and others to leverage connections here in Montgomery County to get the personal protective equipment that the county needs. In terms of health disparities, we have lobbied Governor Hogan successfully to share the breakdown by race of the COVID cases by zip code. You may have seen that when it came out recently. It was very disturbing at the time to find out 3 of the top 4 zip codes in the state were all in Montgomery County in terms of the number of cases, and they were largely on the east side of the county, overlapping my district and including my district, and heavily zip codes with a lot of our Latino and African American residents. Zip codes are all different sizes. You can only draw so much of a conclusion from those data, but the data certainly show that where we have had health disparities for years, they're only exacerbated by this crisis. And people certainly with pre-existing conditions and weak or no health insurance are more likely to become infected and transmit it as well. We're also starting to use this data to focus our outreach and to work directly in the community with our partners like our African American Health Program and our Latino Health Initiative to do targeted interventions, including even door-to-door work in affected communities. And finally, in terms of supporting our most vulnerable residents, we have, the crisis obviously has impacted our residents' ability to access basics that people can take for granted, like their access to food and transportation. So the council has adopted over $2 million in rental subsidies to prevent evictions. We've also passed a historic rent relief bill to freeze rent increases below 2.6% during the crisis and continuing 6 months afterwards. And we've secured $750,000 for food security, including culturally appropriate and locally sourced food, and to create a long-term plan to source more food in our region. We're also doing everything we can to support our small businesses and employers. We have spent over $25 million now in small business grants, and we're giving out small grants to support teleworking as well to help our employers and our workers transition to working from home. And I've been very involved, of course, in individualized issues involving permitting, licensing, and other issues as well. That isn't everything the council's doing on COVID-19, but those are the major issues, and hopefully we'll get to some more during the questions. But please let me know that my colleagues and I are working 7 days a week to do everything we can to mitigate this crisis. Our existing government services are 100% focused on response to COVID at this point, and we are addressing social service requests, tenant issues, health and human services questions, and much more. And as was mentioned, if we can help you directly, either contacting a government agency or a nonprofit organization or a business, please contact my office at 240-777-7960 or email me at tom.hucker@montgomerycountymd.gov. Thank you so much. And let me turn it over to Dr. Travis Gales, who's our county's health officer. Dr. Gales?
Good evening, everyone. Thank you, Councilmember Hucker. To the Senator Van Hollen, good to be on the panel with you. And to all the residents of Montgomery County, it's a pleasure to be with you. The council member talked about 2 months ago. I remember it very clearly. It was 6:15 on March 5th. I had just finished working out and I received a call from the State Department of Health saying, congratulations, COVID has arrived in Maryland and you all had the first 3 cases. And over the last 2 months, we have seen the case count increase in the number of our Montgomery County residents impacted by COVID-19, as well as across the state and across the country. As it stands as of this morning, there are over 33,000 Maryland residents who've tested positive for COVID-19, including 6,909 Montgomery County residents. And as the council member mentioned, unfortunately, we've had over 300 residents who passed away related to COVID-19. Now, as the numbers increase, lots of conversation has centered around how do we move forward? And what does this look like in terms of determining whether or not we'll reopen? I want folks at home to understand that we've got clear criteria that we're utilizing that's based upon public health data, science, and clinical facts. Now, what we're looking at is one of the big efforts that we've undertaken is to increase testing capacity significantly. One of the initial goals was to test 2% of our population. At this point, as of midweek last week, we had tested over 2.3% of the residents in Montgomery County. Our goal is to increase that to over 5% of our population on a monthly basis, because we recognize as we move forward, due to the dynamics of the disease, there's some folks that we may have to test more frequently, particularly our essential employees who have, over the last 2 months, have had to brave the streets and go out and work to provide for their families and continue to provide the essential services for the rest of us to enjoy and be functional. In increasing testing capacity, we certainly will look for that overall number of cases to come down eventually. And there are other measures that we look at in addition to the overall numbers. We look at the percent of folks who test positive who require hospitalization. And it's important to see that percentage drop. When we look at the percentage of hospitalizations coming down, we also want to look at what kind of visits are people having. What's the percentage of folks showing up in the emergency rooms with COVID-like illness? What's the percentage of folks who require critical care and intensive care services? Those are important measures to determine the severity of the virus and if that is improving and decreasing, as well as making sure that our hospitals, as those numbers decrease, have the ability to meet their basic needs in providing care, and certainly have the ability to support another surge if we experience that in the future. One of the other things that we're looking at is something called test positivity. And the reason why I'm mentioning these terms tonight is you're going to hear a lot of these terms thrown around in the next couple of weeks because everyone is interested in figuring out how do we reopen. And what test positivity means is what percentage of the folks that we're testing are coming back positive. And some folks say, I know there was one question that was sent in, well, if folks have been sheltering at home and they've been physically distancing themselves, why is it that we continue to see rates increase? Or numbers increase. Well, one of them is we're testing more people. And part of that is we're really trying to get a true sense of what the impact of the virus is in our communities, particularly in identifying individuals who are asymptomatic. If you think back to only about a month ago, the testing criteria only centered on individuals who were demonstrating symptoms. So you can imagine about a week after that, we found out, no, in fact, maybe as many as 25% of those who are COVID-19 infected are asymptomatic. And so if we can identify those folks who may be unknowingly transmitting within their networks and other spaces, if we can identify those folks quickly, we can get them isolated and begin to interrupt the future networks of transmission that they may have had in terms of infecting other individuals. So to that question of why do the numbers keep going up, there's a lot of different factors, and we recognize that there are some features within our county that make us a little bit different. We've got a lot of folks who are essential employees and who've had to continue to go to work. We do have, in some areas of our communities, a large amount of congregate living situations, very densely populated buildings with a large number of individuals living in one residence. And so that you can think about how those factors can increase transmission. And so we're doing targeted, focused interventions in those areas to increase testing, as well as make sure that individuals have access to the social support services that they so richly need, not only in this time of emergency, but long before in their previous conditions. So I want you to be assured that we are working hard to address all of these different areas, because we recognize that not only do we have to sustain excellence in these responses to reopen, we know that we've got tremendous work ahead of us to make sure that we continue to stay safe and we continue to do the things that we need to do to promote health, safety, and good public health outcomes. As always, happy to answer any questions that you all have, and it's a pleasure serving as your health officer.
Thank you so much, Dr. Gales. We're really lucky to have you as well. Thank you for joining us tonight and for everything you're doing. Now I'm pleased to welcome U.S. Senator Chris Van Hollen. I've had the pleasure to know Senator Van Hollen for many years, going back to when he served us in Annapolis. He's been a tremendous resource, not only to Montgomery County, but to the nation. Senator Van Hollen has been a champion for small businesses, tenants, vulnerable communities, and many more. Back in March, I was lucky enough to join him as he was the first U.S. Senator to attend a meeting with vulnerable residents in our Charter House facility in downtown Silver Spring. And that was just one example recently of his commitment to the county and ensuring our needs are met as part of the conversations in Congress. If you've followed his emails or if you've seen him on TV, you should know he's advocating to remove barriers for small business aid in order to make it easier for small businesses to get through this recession. He's highlighted how immigrant families are doing so much to help us get through this crisis, and the federal government should not be focused on separating them. He's been pushing the Maryland Department of Labor to process unemployment claims successfully, and he's been tirelessly advocating to improve our healthcare system and ensure our frontline workers are fairly compensated and are protected with the equipment that they need. Thanks so much, Senator, for leading on all those issues and many others. You all should know he was elected statewide to serve in the U.S. Senate back in 2016, and is fighting every day to ensure that our state and our county live up to their full promise of equal rights, equal justice, and equal opportunity. He serves on the Appropriations Committee, the Banking, Housing, and Urban Affairs Committee, the Budget Committee, and the Environment and Public Works Committee, all issues critical to our state. So I'm looking forward to hearing the updates I know he has on economic relief and testing and how we can support our frontline workers and local businesses. And after that, we'll go to Q&A. Please help me welcome U.S. Senator Chris Van Hollen.
Well, Tom, thank you very much. And thanks for bringing us together in this virtual town hall. I think the meeting that you mentioned with the Renters Alliance was probably one of the last times that we could actually meet physically. And even then we were beginning the social distancing process. But I want to thank you for all your leadership during this period of time and before. I remember us working together on an urgent basis more than a year ago during the federal government shutdown, which of course impacted lots of residents in this area. And now, of course, we're facing a pandemic that has an even much broader impact, and of course, throughout the state, throughout the country. And thank you for the leadership, and thank you for the actions you and your fellow council members have taken during this period of time. And as Councilmember Hucker said, this has really been a team effort. We've worked closely together as a federal delegation, Congressman Sarbanes, Congressman Raskin, Congressman Trone, Senator Cardin, the whole delegation, working closely with the county executive, as well as the governor and the governor's team. So I want to thank everybody for pitching in, and to all the residents of our county and state who have been working really hard to help their neighbors weather the storm. And Dr. Gales, thank you for your steady leadership and good medical guidance and counsel as we move through this pandemic and begin to find a way to open, but find a way to open safely, because that's got to be a priority. So I'm just going to give everybody an update in terms of what we've done at the federal level, and then look ahead a little bit. And then during the question period, I'd be happy to try and answer your questions. And I know you've heard from others before, so I'm not going to go into lots of detail. But just to remind people that the Congress has now passed 4 pieces of legislation, significant pieces of emergency legislation, all thus far on a bipartisan basis. And none of these bills have been perfect, but taken together, they were absolutely necessary as an emergency response to help weather the storm. And they've been focused really in 2 areas. One is to fight the healthcare battle against the virus and treat people with COVID-19. And the other is to deal with the economic fallout, the economic pain that workers and families and small businesses and others are experiencing because of the social distancing that we have to do in order to beat the pandemic. So let me briefly cover both of those. On the healthcare front, we provided an enormous amount of resources to those on the front lines, the nurses, the doctors, the medics, all the emergency responders, hospitals, very importantly, community health centers, which of course are the place to get access to healthcare for so many in our community, as well as nursing homes and senior living facilities. Now, the money is going to those institutions. Some have flowed a lot faster than others, but about $170 billion will flow nationally in different contingents and different tranches. So then there's the battle to make sure that we have adequate personal protective equipment and adequate testing. And it's been a very different story there, as you know. And there, it's not been a lack of dollars. It's been a lack of national supply and, in fact, international supply. And we're seeing and continuing to see shortages when it comes to personal protective equipment and testing, which is why many of us for weeks and weeks, in fact, months, have been urging the president to fully utilize the Defense Production Act, a federal law that allows the president to direct the private sector to manufacture critical supplies of national need. And I just organized another letter to him recently referencing a part of that law that allows him to provide incentives to these private companies. He doesn't have to order them without them, getting anything in return. If you're a company and you're asked to produce nasal swabs to take specimens, you want to make sure at the end of the day that the government will purchase that, if not for immediate use, for the national stockpile. But he's not been making use of that. And as a result, we continue to see shortages of PPE and real shortages in testing. And as Dr. Gales mentioned, testing is important to identify those who have the symptoms, but it becomes even more important if we want to reopen safely, to be able to quickly detect those who may be asymptomatic but transmitting the disease. And that means, according to all the national experts, we need a minimum of about 3 times as much testing equipment as we have today. And it's really important to remember when it comes to testing that it's not just one thing. You need all the different pieces of testing. It's like a 3-legged stool. You need the nasal swabs to take the specimen, you need the transport kits, then you get to the lab, you need that capability, and you need the reagents. So you can have hundreds of thousands or 1 million of one of those elements, but if you don't have all of them, you don't have a comprehensive rapid testing regime. And so this has got to be a priority as we look to reopen safely, because the last thing we want to do is get on the downside of that curve and then have another outbreak that becomes another bonfire. We want to be able to quickly detect and contain and do the contact tracing so that we can isolate cases if they emerge, so that we don't get another explosion, we don't get more exponential growth in the cases. And that's why that's such an important piece. Councilmember Hucker mentioned the healthcare disparities, and we've seen this from the start. This pandemic has shown a very harsh light on inequities that we've known have existed in our healthcare system. Many of us have been working to tackle these for many, many years, and we need to do it with additional urgency. We're seeing, as was said, that communities of color, especially African-American communities, have been especially hard hit. And that's for a variety of reasons, including the fact you have a disproportionate number of frontline workers, those essential workers who are communities of color. And then, of course, you have the disparities in our healthcare system that have existed. So a lot of communities of color have additional pre-existing conditions that haven't been properly dealt with. And so as Councilmember Hucker did from the county level, I organized a letter early on urging the governor to release the data on a zip code basis. I'm glad that he did it because that not only helps us learn where the disease is, but it also helps us the resources that will be needed to both deal with all the issues that result, but also as we roll out the testing, we'll know where we need to really focus our energies and efforts. So that's the healthcare piece. In terms of the economic fallout, there have been a lot of bills. I'm just going to mention the four major elements, and a number of these are, I'm sure, already familiar to you. But probably the biggest part of the safety net has been the unemployment insurance system, where we did two very important things. We increased the weekly benefit by $600 a week. That's funded entirely by the federal government. So anyone who goes into the Maryland unemployment system would get whatever they normally would have received, plus that additional $600 a week. And we expanded eligibility to people who've not previously been eligible, qualifying for unemployment insurance. So part-time workers, gig workers, the self-employed, independent contractors, they all are eligible. And there's no upward bound on the amount of money being spent in the unemployment insurance system. It's everybody who qualifies will receive the unemployment insurance that they're entitled to. Now, I think everyone knows we've been experiencing huge problems in our state. These are monies that are essentially processed through state unemployment agencies. Maryland's computer system, the vendor that was picked, was really a disaster, and the system crashed about 10 days ago, and it has never really, and still today, is not fully up and running. So we are working, all of us, to try to encourage the state to put together the resources needed to have that function more smoothly. The federal government has provided 2 rounds of funding to the state of Maryland to help hire navigators to help people through that process. The one silver lining there is that when you do get processed through the unemployment system, the additional $600 and the funds you receive are backdated to the time you're eligible. Another major program was the PPP program, the Paycheck Protection Program through the Small Business Administration. It has helped many people, but it has also had its own share of problems. But this has been a challenge for us because we wanted to make sure that the funds got to the small businesses that needed the most. And I think, as people have seen reported, certainly the first round, a lot of banks put up their own conditions. For example, saying that the proposed borrower, the applicant, had to have a pre-existing lending relationship with the bank. That was never part of the bill, but that was a condition they imposed. So when Mitch McConnell wanted to replenish the PPP fund, I went to the Senate floor along with Senator Cardin and said, not so fast. We're not going to put more money into this, because in addition to money, we need to make reforms. And the second round channeled over $60 billion through more community-based lenders, including $30 billion through CDFIs and minority depository institutions. Despite that, there are still significant problems with PPP. Some that Secretary Mnuchin unilaterally applied, and there was just today a report from the Inspector General making clear that the condition that businesses could only use 25% for fixed costs was something that was imposed through the regulations. It is not in the underlying law. I've spoken directly to Secretary Mnuchin about this, and I'm hoping now we will have the ability to reverse that imposed condition. They put some other conditions on that were not in the law, and the law has some design issues that I thought we should have fixed on the second round, but we hope to fix in the next round. Emergency disaster loans are another tool, but again, those are being drawn down very quickly. A third plank of the relief effort was the individual payments based on income eligibility. I think everyone's familiar with those. And the fourth was the assistance to state and local governments and schools and a number of other federal assistance programs. The good news is that Montgomery County, because it has over 500,000 people, is eligible to draw directly on the U.S. Department of Treasury. They don't have to go through the state of Maryland to get their funds. They'll get $180 million in relief, which is a good sum, but only a down payment, not what the county needs, just like the monies that come to the state, the $2.3 billion are not enough. And also, very importantly, there's not enough flexibility in how Councilman Hucker and his colleagues in the county executive can use those funds. They can use them to pay for expenses that would not have been incurred except for the coronavirus, but they cannot use them to pay for deficits, revenues lost because of the coronavirus. And so as we look to the next bill, we want to both increase the amount of funds available to state and local governments and first responders, but also allow the funds to be more flexibly used. In addition to the funds that came to the county and the state, there are funds that went to our school systems. According to the Title I formulas, I was successful at getting a provision included that said that schools could use those funds to address the digital divide, to address the homework gap. This is another example where the coronavirus has exposed deep divisions, again, that many of us had worked on before this hit. I had legislation to deal with the homework gap, and now we're pushing even harder. And on the next round, I hope to include really dedicated funding for that purpose. There are also other federal funding sources that come to the county for emergency homeless grants. Food assistance programs have been increased. But on the next round, and I'll just close with this, we need to do a number of things. We need to increase the amount of funds available to state and local governments. Otherwise, Montgomery County, the state of Maryland, cities, towns won't be able to, provide the services that are essential in order to help people in our communities. We also need to increase the food assistance provisions. I think we've all witnessed the real need and the long lines, and so those are things we have to do. We also, in my view, should look at hazard pay for our frontline workers. We also need to look at making sure we fully fund the post office. As those of you who have been following this issue know, the president's been playing games with funding for the United States Post Office. So we need to make sure that we address that issue. And finally, we need to look at whether we need to extend things like the increased UI and also provide funds for testing. I and some of my colleagues have proposed an AmeriCorps type program to bring on people to do the contact tracing and additional testing. So those are some of the elements that will be debated in the next bill. As you've probably seen, Mitch McConnell several weeks ago said, no, we don't want to do funding for state and local governments. Let them all go bankrupt. He had to walk those statements back a little bit, but it is a sign of the fact that this will be a much more difficult round of relief. It'll be harder to get bipartisan support, I believe. And what you're going to see this coming week is likely the House of Representatives, probably on Friday, will unveil their piece of legislation, but it will have a long road to travel from the House of Representatives to the White House for signature. And so we're going to need everybody to rally together. This fight is far from over, but thank all of you for doing your part for your neighbors in our community. And Tom, thank you for bringing us together this evening.
Thank you, Senator. Back to you for questions, I think, Susan.
Yes, we do have several people waiting in the queue for questions. The first tonight comes from Jill Gay from Annapolis. Chris, the CARE Act allows unemployment for gig workers, but Maryland DOL questions on unemployment are not suitable for gig workers. What can be done to address this?
Right, we've had numerous problems with the Maryland Department of Labor in terms of processing these claims, because as the question indicated, the CARES Act does allow unemployment insurance benefits to gig workers. It's one of the positive reforms to meet the emergency that we had. And so it's based on certain kinds of documents that need to be provided to show the loss of income in a household. You can, on a particular issue, since if you're calling from Annapolis, please call our team, my office. Scott Travers is our person on the ground there. If you want to come through Tom Hucker's office and through the email or directly email our office, go to our website at assistance@vanhollen.senate.gov. We are taking those constituent matters. So if it's a question of how long it's taking to process, as you know, unfortunately, that's a problem lots of Marylanders are having. But if it's a question of them not accepting documentation that shows the loss of income, that's something that we should be able to help you with.
Okay, great. The next question comes from Barbara Sosnick. When are drive-through testing sites in Montgomery County going to be available where a prescription referral is not needed? Sussex County, Delaware has such sites and they pay much lower taxes than we do.
Well, that's a very good question. And I've been wondering the same thing. And I know Councilmember Hucker has, as Dr. Gales has as well. Because what we learned is that having hundreds of thousands of one part of a test is not sufficient to have an adequate testing regime that can allow for that drive-through testing. That drive-through testing and the testing of people who are asymptomatic is, as Dr. Gale said, going to be a really important part of our strategy going forward. We have sort of regular conversations between our staff as well as the members of the federal delegation and the governor and the State Department of Health. We continue to push them for updates. I know that they've been working to try to get more testing in nursing homes, and we do need to make sure that we're doing that. I think that is still very much a work in progress as well. So we're pushing. I will just go back to the point I made in my opening comments, which is on a national basis, we need to be producing these tests ourselves, all the different components. And that is why it's so frustrating the president has not ordered U.S. companies in productive capacity to take on this challenge. My goodness, during World War II, we built bombers every day. Now we're having trouble getting nasal swabs, for goodness sakes. They asked one company in Maine to increase its production under the DPA, but we need to do a lot more than that. And we need to deploy lots more workers to do the contact tracing. So this has been unfortunately, a national failure, and we're going to keep pushing for greater production.
Okay.
Susan?
Yes.
I just wanted to add to the Senator's comments and in terms of volume. So we recognize there's limitations on testing, and so our approach has been at each point as we've expanded to be nimble and respond. So we started with one deep site, and that's 2 days a week. We expanded that to 2 other locations. 2 of the locations are in those high volume zip codes that were mentioned in reference before. We've created another site, which is on the Up County at the Germantown Regional Service Center. And we said, okay, well, there's still an issue for people without cars. So we've have a rapid response team that has been going in physically to people's homes that have their names have been sent to us in crisis to test there. We are creating, this week, we will be standing up a mobile testing army, so to speak, that will be able to go to locations throughout the county that have been deemed hotspots to be able to test there. Also be able to augment, as the Senator referenced, helping with the nursing home testing component, as well as we have a number of developmentally disabled homes throughout the county that could use that testing as well. And then one of the other components is that we are creating a hotline for individuals who don't have a medical provider to be able to call in and get triaged and screened to determine whether or not they meet the criteria and will get a referral. The last piece I want to mention is to the point of yes, without having to have a provider provide the referral. So that's less to do about a tax base and more to do with the criteria that CDC and states are using. What they did is they, over about 10 days ago, the CDC introduced an additional criteria, meaning that, to the senator's point, they said that asymptomatic folks can be tested, and they kind of left it up to the jurisdictions to make the distinction of who fits in that category. What we have decided is to encourage providers to test asymptomatic individuals who are our essential employees, who've had to come out and work over the last couple of months and be exposed to different things, as well as asymptomatic individuals who are contacts of known lab confirmed positive cases. Because we think if we can capture that many folks, we can find a good amount of those asymptomatic cases, get them isolated, and then interrupt those transmission networks. And to that end, stay tuned. We've been working behind the scenes to stand up a larger testing option to address those concerns. And hopefully in the very near future, we'll be able to release some more details to give insights into that effort.
Great, that sounds exciting. The next question is to Sean. He asks, can you make a comment on the further outlook on MCPS transportation outlook? Tom, I don't know if you know anything about that with MCPS and transportation. Is there any news on that?
I'm not, if he's asking about when schools will return, I mean, the answer is not till the fall, and we don't really know beyond that. And I don't know if Dr. Gales has anything to add, but we're sort of at the mercy of the state as to when that gets stood up. We do have, we're in the middle of our budget, and I just asked this question last week to the superintendent. We're saving a fair amount of money, not driving 1,300 buses every week, but we are using a bunch of our buses to actually, I meant to mention this earlier, to deliver food relief to our families that are used to getting their meals, many of their meals through our school system. So our buses, some of them are still in use doing that, and I'm sure that'll continue until schools resume. Dr. Gales, am I leaving anything out?
Got nothing to add. Sounds good.
Okay, next question is from Colleen Thomas, and she asks, moving forward, how does an essential person and a high risk over 60 individual who does not live together resume a negative social distance relationship? So I guess that sounds like somebody who has to be out living with somebody who's over 60. How do you socially distance in that situation, if I'm understanding that correctly?
Well, I may leave that to Dr. Gales.
Yeah.
I've been careful to make sure I leave these questions to the medical experts. I think that guidance should be followed at the national level as at the county level.
Well, I think one of the big components of this, to answer the question, is not to belabor a point. Increased testing capacity will allow us to be able to better understand an individual's testing profile. If we have increased access to testing, then you don't have to play the guessing game of, I know I've been going out in public, am I positive or not? And that can have a substantial impact in terms of knowing the interpersonal dynamics in a relationship or in a family situation where you're living with someone. And it can help you decide if, within your living space, how to go about physically distancing yourself in terms of quarantining and isolating. We know that has, many people do have the opportunity to do that. For example, when folks test positive, part of the conversation is, okay, what does your home life look like? Do you have separate bathrooms? Do you have a basement? Do you have spaces where an individual who tests positive can separate themselves from the rest of, or physically, put up some barriers to minimize transmission? Now, conversely, we know that is unfortunately not a reality for many folks. And this speaks to some of the economic disparities that are impacted by disease. So you think about it, if you are in a home in a 2-bedroom and you share that with 10 to 12 other folks and there's one bathroom, you can imagine how it makes it challenging to isolate in space and how that could potentially increase the likelihood of transmission. So I say all that to say that increased testing will allow us to be able to test more frequently so folks know their status, but also there are some strategies within your physical blueprint that you can implement to increase some space between you and your loved ones.
Very good. Now we're going to be joined by Dr. Butler from Silver Spring, who has a question.
Thank you so much. And I want to thank everyone for doing this, from Hollen, Dr. Gail, and Tom. I want to thank you guys so much for doing this and keeping everyone up to date and informed. A question that I have, well, first I want to make a statement. I'm wondering, why are we moving too fast to reopen? And are we really taking this seriously, because so many new cases are coming up and it's coming very close to home. I've had, unfortunately, a board member pass away from COVID-19 and 2 more individuals of mine who are now currently infected and just got out of ICU. And we're seeing more cases, and here we are opening up our beaches and other things like that. Are we moving too fast? And then the second question I have, what is going on in the criminal justice, our institutions, our jails here? How many of those individuals are being infected? And what are we doing to help protect them on a daily basis?
Well, Dr. Butler, it's good to see you virtually here. And thank you for all your work in our community. So let me start with the last piece and then the first piece and turn it over to whoever else wants to answer as well. So you're absolutely right. We've seen our prisons become, kind of incubators for this disease, which is why, again, I organized a letter from the Maryland congressional delegation many weeks ago, urging the governor to essentially provide less restrictive detention, home release to individuals who don't pose any real threat to the community, and early release for people who don't pose a threat and may be elderly or more likely and susceptible to get COVID-19. I'm pleased he did take some actions in that direction. We've also written to Attorney General Barr on this issue, and while Attorney General Barr, I disagree with them on 99.9999%, probably more, of things. This is an area where they did, even with respect to some of the federal correction facilities, allow for the early release or home detention of some individuals. All that said, we need to do more, and we actually push them hard now on the personal protective equipment issue, because in addition to trying to make sure that we reduce the concentration of people in prisons for the social distancing reasons, there's also been a lack of PPE in both the state and the federal prison systems. And so we've been pushing them very hard on those fronts. And we will continue to do so because, it's a risk to the correctional officers, it's a risk to the prisoners, and it's a risk to all the community members who live in those areas. So we need to make sure that we don't allow the virus to spread anywhere. With respect to, opening up too soon, in this region, both the governor of Maryland, as well as the mayor of the District of Columbia and the governor of Virginia, have moved in have synced up for a lot of their actions. Now, as you saw, Virginia began to move more quickly. In Maryland, we really haven't, as I understand it, entered phase 1. We've taken some steps with respect to opening on a risk basis certain kinds of activities. But we have not yet entered sort of, the phase 1 of decisions in terms of reopening. I think that whether that comes later this week, I think all of us recognize that reopening is we have to define what it means. It's not like throwing a light switch where we're going back on. It's going to have to be more like a dimmer light. And it is really important that we continue to observe all the guidelines that Dr. Gales and others have spelled out, because if we don't, we're just going to have a new flashpoints and a new explosion of the pandemic. And so you're right, we need to be very cautious and smart about how we reopen, and hopefully we'll all work together to do that.
And
Thank you.
Dr. Butler, if I could just add, Dr. Gales may have more specifics, but when the governor announced his phased approach to reopening the state, obviously he's frankly under a fair amount of pressure from his supporters, and he's looking at a very big and diverse state. Not as big as many, but certainly it's very sprawling, and Garrett County is quite different than Baltimore City. So there are a lot of different considerations, and what he established is essentially a floor, but there's no mandate to counties that we have to do everything exactly at the same time, or the same time the state allows things. We can be more restrictive. And to his credit, I think the county executive has said, we in Montgomery County, where we have more density and we are leading the state in the cases now, along with Prince George's, we will not be following the state's schedule. We will keep things more restricted for a while until Dr. Gales and our health professionals tell us it's okay to reopen things in the iterative manner that the Senator mentioned. So, that's how we're going to be approaching it. I've encouraged the county exec to look at things that way. I know other members of the council have as well. We're all very supportive, I think, and united in the fact that protecting public health comes first. We are going to be dealing with this historic recession, but the most important thing is to keep our public safe. And that's how we're looking at it. We don't need to follow the state. We need to do everything that's right for Montgomery County.
I would just add that in addition to that, so you trust and believe from my mouth to your ears that we're going to follow the data and do what's right from a health perspective, specific to our needs. And that extends to our colleagues in the rest of the National Capital Region. We've worked very closely with the health officers and the elected officials in Southern Maryland, DC, and Northern Virginia. And we are all on the same page. In fact, we had a great regional call this afternoon where we talked about the respective health indicators that each of our jurisdictions are doing. Some of them may be a little bit different, but the consensus was that we're not ready to reopen, and we're going to move together as a region because we recognize that so many people move back and forth across our borders, whether it's work, play, or seeing family. And it's important that we move together and do this to keep us all safe.
Yeah, it was clear that Northern Virginia was going to move at a different pace than other parts of Virginia. So to your point, Dr. Gales.
Thank you, Dr. Butler. We appreciate it. Our next question is from Victoria Baldessano. She says, I'm president of the part-time faculty union at Montgomery College. The college shut down right before spring break, and the faculty struggled to learn how to teach remotely when the college reopened. In the fall, many part-time faculty members have been told they will not have courses because of a variety of reasons. Full-timers have first priority for classes. Part-timers earn less than half of what full-timers earn for teaching the same courses, an inequity that should be addressed by the county council. Many of us have other jobs to make ends meet, and many have lost those other jobs or lost income. If part-timers do not have courses in the fall, many will be faced with hardship. What can you do to help adjunct faculty members? Teachers are necessary workers too.
Well, that might be for me.
Yeah.
Victoria, thank you for your question. And I'll try to answer it as well as I can today, but I'd be happy to set up a meeting with you and your members so we could talk about it in more detail. I'm not sure. I'm sensitive to the inequity that you're talking about. I'm sorry for the pressure that is on you and your members didn't start with COVID. You've always, in my view, been underpaid, underappreciated, and you do really essential work for our students in the county, and are critical to not just their development but our overall economic development. And the inequity between full-time and part-time, I'm not sure if we can, or whether we can order that addressed, given that you bargain directly with the Board of Trustees of Montgomery College and they get their authority directly from the state, not the county. But I'm happy to look into it. I would like to do anything we can to address the inequity. And I, certainly, I support as much funding as we can to the college so we can create more full-time. I realize not all your part-time staff may be looking for a full-time job, but the more we can address the inequity and the more full-time jobs we can create, I think the happier, I imagine all your members will be. But I'm happy to have a meeting to talk about the details.
Okay. The next question is from Rich Peterson. The SBA consistently switches up the rules and the state of Maryland cannot be contacted in any way at any hour. Can a Maryland resident and taxpayer participate in the PPP plan and Maryland state employment insurance for the self-employed? Any support and assistance you could provide is appreciated.
Can you repeat that question? I just want to make sure I understand.
Yeah, the SBA consistently switches up the rules and the state of Maryland cannot be contacted in any way at any hour. Can a Maryland resident and taxpayer participate in the PPP plan and Maryland state unemployment insurance for the self-employed?
So a self-employed person
Right.
can a self-employed person who can qualify for the PPP program and a self-employed person who's lost income can also separately qualify for unemployment insurance. And they have been, self-employed individuals are not traditionally part of the unemployment insurance system, but under the emergency legislation under the CARES Act, they are eligible. Now, this is the part of the Maryland uninsurance system that has had an especially difficult time getting up and running. And so many people who qualify still have not been able to access those benefits. But for somebody who's self-employed and who has lost income because of this pandemic, you can go into the unemployment system. And as I said, you could also choose to go into the PPP program. So again, if somebody is looking for that kind of assistance, if you go to assistance@vanhollen.senate.gov, we do have people who are working on this. Now, this does raise a question, not necessarily for this individual, but I do want to point out that Maryland as a state has what's called a work share program in our unemployment system. About half the states have this. It's a good innovation. And what it means, for example, if you were a small business and because of the coronavirus, you had 10 employees and you thought you had to lay off 5. Instead of laying off 5, you could put 10 on half-time. And those 10 employees can still go into the Maryland unemployment insurance system. And at least during this emergency period till the end of July, they also qualify for the additional $600 per week. So this is an option that a lot of small businesses have not focused on and their employees have not necessarily been aware of. But it is an option because Maryland is a work share state. And I actually am working on a proposal that we're going to try and include in the next round to make that work even better by making sure small businesses can get funds that they can use for their fixed costs, like their rent or mortgage, which the Treasury regulations made much harder to do under the existing program. So, but the bottom line to the question was, if you're self-employed, you can qualify for unemployment insurance, or you can get PPP. I know that both right now are very frustrating. So I don't know which to recommend as to what the best option at this point in time is, but you do qualify for both.
Okay. This question is for Dr. Gales from Stephen Schiavone. What percentage of COVID cases require hospitalization in Montgomery County?
It's a great question. So let me level set this a little bit. The state level data is a little bit easier to follow. So right now, our hospitalization rate for COVID-19 is approximately 19%, 19 to 20%. And it's important to, when you think about that number, a month ago, that percentage was approximately 26%. So even though we've seen more cases come, the overall number of folks requiring hospitalization has decreased. Now, when we look at Montgomery County specific numbers, I would say we're in that ballpark, around the low 20s, 20 to 21%. And because that gives us a sense of what is the impact on our health system, we continue to follow that as one of our key indicators to determine, again, back to the earlier questions, are we ready to reopen? So what we're looking at is a sustained decrease of hospitalizations overall, and particularly that overall hospitalization rate coming down.
Okay. And now I think we have David from Rockville who will be with us virtually to ask a question.
Hi, thank you. David Damon from Rockville. I don't live in Tom's district, but my mother does. Senator Van Hollen, could you please tell us if there's any chance of future legislation to provide additional federal funding to support vote by mail across the country? And Tom, thank you for supporting vote by mail in both Maryland and Montgomery County and for being a consistent supporter of voting rights more generally. Interested in your thoughts about it as well.
Well, David, thank you for your work on this issue. Good to see you virtually here. And we are going to press for national standards to allow many more viable options to vote by mail. As you know, there's a great variety right now as to what states permit and don't permit. Some states have vote by mail. Others are very restrictive even when it comes to getting an absentee ballot. They still require that you come up with an excuse as to why you're not there, and you've got to submit it under penalty of perjury. In some states, you need a notary to sign it, which of course would severely limit people's ability to even do an absentee ballot in order to protect themselves during this time of COVID-19. So we're going to push for two things in the next round of legislation. Number one, additional resources for states so that they can adapt their voting systems to allow more vote by mail and an option to vote by mail. We'll also push for that as a national standard. As you know, Republicans in the Trump administration have resisted the idea of establishing a national standard, but this will be part of the discussion. I think the House bill that's going to be voted on maybe Friday or after that will have those kind of provisions. In addition, we've got to be on full alert because right now, and this is a reality, it's not a political statement, you're seeing the Republican National Committee going into courts in lots of states trying to limit states' abilities to enact vote by mail options. So we are going to continue to push for that at the federal level and protect the right to vote in the states. And finally, this is another reason why we got to make sure the post office is fully up and running and functioning so that people can cast their votes by mail whenever possible.
Thank you.
Great. Okay, our next question, I believe this will be for Mr. Hucker. Sharon Jones asks, how soon will rental subsidies be available and how can those impacted be found eligible to receive support?
Thank you, Sharon. Rental subsidies are available now, as far as I know, unless there's some holdup, and you should definitely get in contact with our office for individual casework. But we've allocated millions of dollars, both for rental assistance for people who are having trouble paying their rent and emergency eviction prevention for people who are facing eviction. While the courts have stayed eviction for a while, all those bills will come due at the end of the emergency. So we're keeping an eye on that as well. But both of those funds have been made available by the county. And thank you, Senator. I should have mentioned the $183 million that we're getting from the CARES Act from the federal government is in the Montgomery County Treasury now. And that's going to go to things like rental assistance and to food assistance and to hazard pay for our frontline workers. So I hope that we're going to be able to make more available, but right now we've already allocated millions of dollars for rental assistance and people should try to take advantage of it. And just please get in touch with our office for additional advocacy to connect you with the Department of Housing and Community Affairs.
Okay. I believe we have Kim from Silver Spring ready on the line virtually to ask a question.
Hi, thank you all for this town hall meeting and for all that you're doing, working so hard for all of us. As a citizen, it's so frustrating, and I don't understand why our president won't use the Defense Production Act so that we can have all the materials we need for the amount of testing we need. And I don't understand why there isn't a coordinated federal response.
Well, Kim, you're absolutely right. I mean, this is really the biggest sort of shortcoming in the whole approach that we're taking as a country is it's very fragmented. The president essentially says we're going to let every state do their own thing. That is not the way to conduct sort of a national, war on a pandemic, right? Because you really need to mobilize the national capacity to do that, both when it comes to personal protective equipment, but very importantly when it comes to testing, especially when it comes to testing at the scale and rapidity that we want, that Dr. Gales was talking about. So that if you want to make sure you can make sure all your workers that are going back to work are, put it this way, if the White House folks supposed to the president get tested, once a day, apparently now. At least we should have an adequate supply of testing for others that are going back to work. And so we're going to keep pushing. There's some bipartisan support for essentially forcing the president to engage with the DPA. There are questions about whether or not you can force the president to do it, but we intend to try and write that into the next round of legislation. It's not a lack of funds. There are funds available to do this. It's a question of exercising the authorities under the Defense Production Act. So it's a question on everyone's minds, and because it shows a complete void in our response and lack of leadership, in my view.
Okay, I would like to mention very quickly that we do have Senator Cheryl Kagan and Bridget Smith from Congressman John Sarbanes' office with us listening. We appreciate them being here. And we're going to have to wrap up our questions for the evening. I'm going to turn it over for some closing remarks, but do remember that you can email your questions to Councilmember Hucker's office. And I think the Senator also gave out his email as well if you have questions for him, but I'll turn it over to the gentleman for some closing remarks.
So Tom, do you want me to go first, Dr. Gales?
Please go
Okay.
ahead, Senator.
All right. Well, let me thank everybody who's joined us on this town hall gathering. To Dr. Gales, thank you for your leadership and guidance on the medical front and other dimensions here. Susan, thank you for moderating this evening. And Tom, really thank you for bringing us together and for your leadership. Because what we know is that in order to be successful in responding both on the healthcare front as well as dealing with the economic pain, is we all have to be working together. Just like I think all of us have been hardened by the fact that neighbors are helping neighbors. We have, people who are not able to go to the grocery stores. Their neighbors are doing that. They're delivering food. They're raising funds. Many people are working to make masks and other personal protective equipment. So it is really important that we keep helping each other. It's also important that as we work toward reopening, we do this on a science-based, fact-based, in terms of those guidelines, because we want to make sure that we don't see a resurgence of a virus, which is still very much still with us. But we also want to make sure we provide people with the economic assistance to weather the storm. And that's what the federal programs are designed to do. They're not perfect, and we welcome the input of all Marylanders as we decide what steps to take next. But thank you all very much. And to Tom, thank you for your leadership.
Thank you so much, Senator. Dr. Gales, anything to add?
Just want to say thank you for the opportunity, and to all of the residents at home, thank you for continuing to be patient with us. This has been hard. This has been tough, and we've still got a long way to go. But thank you for your dedication. Thank you for your patience. Thank you for your expertise in working with us to get through this. So I just want you to know that we continue to give you, the residents of the county, our best effort, and we'll continue to do so and be guided by science, data, and facts. That's all I have to say.
Those are good words to close on. Thank you so much, Senator Van Hollen, again, and Dr. Gales for your updates and your expertise. And thank you so much, Susan, for keeping us on track and moderating tonight. And I want to thank everybody for joining the town hall and for your great questions. If we weren't able to answer your questions tonight, please either put them in the chat box, or if you haven't already, send us an email and we'll get back to everybody individually. Our very first town hall, we had 2,500 people participate, and we had over 500 questions we answered individually afterwards. Again, the county government and my staff are here for you, so please don't hesitate in reaching out to us tonight and every night. And as Dr. Gale said, I know this is a frustrating experience. Many of you, like I am, are home with a couple of kids who are stir crazy. Many people have a small business that is really struggling at this point. But I encourage everybody to follow the public health guidelines Dr. Gales is putting out. Our cases, unfortunately, and our deaths are still increasing in Maryland, despite what's happening in some other states. And the sooner that we follow all the guidelines correctly, the sooner we're going to get through this and keep everyone as safe as we can. I'm proud to say that our community continues to be really resilient and caring place during this emergency. Many residents have been mobilizing and advocating and donating their time and their money, and many people have stopped everything that they're doing to help those in need. We've seen people delivering food and making masks and checking on their neighbors and supporting our frontline workers and many other things, which is exactly what you'd expect from a community like Montgomery County. They really reflect our values. They make a huge difference in people's lives. And you can certainly, if you have time on your hands, volunteer with the county through Volunteer Montgomery. There's many, many ways you can if you have a little additional time on your hands and you have expertise, you can put yourselves to work keeping our residents safe. Again, I know I'm proud to serve you on the Montgomery County Council and committed to keep working together with all of our elected leaders and our professional staff to get through this together. Thank you again for attending, and to join next week's town hall with Congressman Jamie Raskin, just go to tomhucker.com/coronavirus and sign up for next week's town hall as well. Thank you so much, Senator. Thank you, Doctor. Thank you, Susan.
Thank you.
Good night.
Thank you.
Good night. Thank you.